What if your legs were trying to save your life, and you were too busy to listen? Right now, as you sit or stand, your legs are working harder than any other part of your body. They are carrying you, supporting you, pumping your blood, and fighting silently against forces that could kill you. But here is the terrifying part. Most people look at their legs every single day and completely miss the warning signs that doctors spend years learning to recognize. What if that swelling in your ankle is not just tiredness? What if that cramp in your calf is not just dehydration? What if that strange color on your skin is your body screaming that a blood clot is forming right now, this very second? The truth is, your legs do not lie. They speak a language. And today, right here, we are going to teach you exactly how to understand every single word they are saying. 7 warning signs. 7 life-saving messages, and every single one of them could be happening to you or someone you love right now. Stay with me, because what you are about to learn could change everything. What if your legs already know that something is terribly wrong inside your body, and the only question is whether you are paying close enough attention to hear what they are telling you? Most people treat their legs as simple tools, things that carry them from one place to another, things they stretch after a workout, things they cover with clothing and forget about until something hurts badly enough to force attention. But the truth, the deeply unsettling, medically documented, scientifically verified truth, is that your legs are one of the most powerful diagnostic windows into the health of your entire body. Your heart speaks through your legs. Your blood vessels scream through your legs. Your nervous system whispers warnings through your legs long before any other part of your body even begins to show symptoms. And that is exactly what makes ignoring these signs so extraordinarily dangerous. Today we are going to walk through 7 warning signs in your legs that your body is using as distress signals. Signals that millions of people dismiss every single day as simple tiredness, aging, or minor inconvenience. By the time you finish listening to this, you will never look at your legs the same way again. Warning sign number 1. Swelling that will not go away. What if that puffiness around your ankles is not just the result of a long day on your feet? What if it is your body desperately trying to tell you that your heart is struggling to pump blood efficiently enough to prevent fluid from pooling in your lower extremities? When you notice swelling in your legs, particularly swelling that appears in one leg more than the other, swelling that is warm to the touch, swelling that appears suddenly without any obvious cause, like standing too long or eating salty food, your body is raising a red flag of the highest order. Swelling in the legs, medically referred to as edema, can signal a breathtaking range of serious conditions. It can mean that your heart is weakening and losing its ability to circulate blood properly. A condition known as congestive heart failure, which affects over 64 million people globally and kills silently over months and years before most patients even receive a diagnosis. It can mean that your kidneys are failing to filter excess fluid from your bloodstream, allowing that fluid to leak into surrounding tissues and accumulate around your ankles, feet, and calves. It can mean that your liver is damaged and no longer producing enough albumin, the protein that keeps fluid inside your blood vessels rather than leaking out into your body tissues. But perhaps most urgently, swelling in one specific leg, accompanied by pain, warmth, and redness, is one of the clearest and most frightening indicators of deep vein thrombosis, a blood clot forming inside the deep veins of your leg. This is not a condition to monitor and wait on. This is a medical emergency, because that clot, sitting quietly in your leg right now, has the biological ability to break free from its location, travel through your bloodstream, pass through your heart, and lodge itself inside your lung, cutting off oxygen supply in what medicine calls a pulmonary embolism, an event that can kill you within minutes. Over 100,000 Americans die from pulmonary embolism every single year. And a shocking proportion of those deaths begin with a swollen leg that someone decided to ignore. Do not ignore swelling. Do not explain it away. Do not wait to see if it gets better on its own if it comes on suddenly, affects one leg differently than the other, or comes with any kind of pain or warmth. Get it checked. Get it checked today. Warning sign number 2. leg pain, or cramping during walking? What if the cramp that forces you to stop walking halfway down the street is not just poor fitness or muscle weakness, but your arteries literally choking, narrowing down to dangerous levels, and starving your leg muscles of the oxygen-rich blood they desperately need to function? This condition has a name. It is called claudication. And it is one of the hallmark symptoms of peripheral artery disease, a condition that affects over 200 million people worldwide and dramatically increases your risk of heart attack and stroke. Here's what happens inside your body when claudication strikes. Your arteries, the blood vessels responsible for delivering oxygen and nutrients to your muscles, become narrowed and hardened through a process called atherosclerosis. Plaque, made up of cholesterol, calcium, and cellular debris, builds up on the inner walls of your arteries over years and decades, slowly restricting the flow of blood the way rust and mineral deposits slowly choke a water pipe. When you are resting, your muscles need relatively little oxygen, so even the reduced blood flow is often enough to keep you comfortable. But the moment you begin to walk, the moment your leg muscles begin working and demanding more oxygen, the narrowed arteries simply cannot deliver enough blood fast enough. The muscles begin to ache, cramp, and burn. The pain forces you to stop. You rest. The blood catches up. The pain fades. You walk again. The pain returns. This cycle, pain during activity, relief with rest, is the textbook pattern of peripheral artery disease. And it is not simply a leg problem. It is a whole body arterial problem. The same plaque narrowing your leg arteries is almost certainly narrowing the arteries around your heart and brain as well. People with PADI are 4 times more likely to have a heart attack. They are 3 times more likely to die from cardiovascular causes. And yet, because the pain occurs in the legs rather than the chest, millions of people write it off as a muscle problem, a fitness problem, a getting older problem, and never seek the help that could save their lives. If walking causes leg pain that consistently appears at a similar distance or level of exertion and consistently disappears with rest, please take this seriously. This is your cardiovascular system speaking directly to you through your legs, and what it is saying deserves your full and immediate attention. Warning sign number 3. Changes in skin color. What if the strange color appearing on your leg skin is not a bruise, not a rash, not a harmless discoloration, but a direct visual signal that blood flow to that area has been compromised in a way that could cost you that limb or your life? The skin of your legs is extraordinarily sensitive to changes in circulation. When blood flow is healthy and robust, leg skin maintains a consistent, normal color, warm, well-perfused, and alive. But when something goes wrong with circulation, the skin begins to change color in ways that are medically significant and deeply important to recognize. Pale or white skin on the leg, particularly when the leg is elevated, suggests that arterial blood flow is critically reduced. The leg is not receiving enough oxygenated blood. This is a late-stage sign of severe peripheral artery disease, and in its most advanced form can progress to critical limb ischemia, a condition where tissue begins to die from lack of oxygen. If left untreated, this leads to gangrene and amputation. Blue or purple discoloration, particularly in the toes and foot, can indicate that oxygen has been so severely depleted in the tissues that the blood has turned dark and deoxygenated. This color is called cyanosis, and it is treated as a medical emergency in any clinical setting because it signals that oxygen delivery to that tissue is failing. A reddish-brown discoloration that appears on the lower leg, particularly around the ankle, is called hemosiderin staining. It occurs when red blood cells leak out of damaged and congested veins into the surrounding tissue. Iron from those broken blood cells stains the skin permanently. This is a sign of chronic venous insufficiency, a condition where the veins of the leg can no longer return blood efficiently to the heart. Left untreated, chronic venous insufficiency progresses to painful, slow-healing skin ulcers that become vulnerable to life-threatening infections. A bright red, warm, tender area on the leg that spreads rapidly and feels hot to the touch could be cellulitis, a bacterial skin infection that spreads through the tissue and can enter the bloodstream, causing sepsis and organ failure. Your leg skin is not just covering your body, it is communicating your body's internal state. Learn to read it. The colors it shows you are among the most urgent health messages your body is capable of sending. Warning sign number 4, numbness, tingling, or burning sensations. What if that pins and needles feeling in your foot that you assumed was from sitting in an awkward position is actually a symptom of nerve damage that has been progressing silently for months, and your window to stop it from becoming permanent is closing right now? The sensation of tingling, numbness, or burning in the legs and feet, medically termed peripheral neuropathy, is one of the most common and most misunderstood warning signs that the human body produces. People laugh it off, shake their leg, walk it out, and think nothing of it. But when this sensation occurs regularly, without an obvious positional cause, or when it is accompanied by weakness or a burning that feels like fire in your feet at night, it demands serious investigation. Peripheral neuropathy affecting the legs is most commonly associated with diabetes. In fact, over 50% of all people with diabetes develop some form of peripheral neuropathy during their lifetime. What happens is this: chronically elevated blood sugar damages the tiny blood vessels that supply the peripheral nerves with oxygen and nutrition. Without that supply, the nerves begin to malfunction and slowly die. They misfire, sending pain and tingling signals when there is no cause for pain. They lose function, creating numbness and loss of protective sensation. And this loss of